So the first thing to understand is the role of medication. The transplant will grow regardless of whether or not a patient takes medication. The medication is to maintain and potentially thicken their existing native hair if it is starting to miniaturize. Another interesting question is, at what point should someone start taking medication? Because clearly you wouldn't want to start it before there's any evidence of any male pattern hair loss, but you wouldn't want to leave it so late until they've got nothing left to salvage with medication. So I think the best time to start it is when you can see the process of miniaturization starting. Perhaps they know they've got a family history of male pattern hair loss and they start seeing some thinning, so they know there's a condition there to treat, but they haven't let it go past the point of no return. In terms of options, the conventional two that are licensed in the UK are Finasteride Minoxidil. Conventionally that comes as oral finasteride and topical minoxidil, but these days there's a variety of different options, both in terms of drug and route, to tackle hair loss. So it's not so much finasteride or nothing, like a lot of people think. It's the willingness to take something that's going to preserve and thicken their native hair. And if the patient has that willingness, then you can almost always settle on a treatment plan that suits them and their lifestyle.